Okay. Howdy, my name is Chrissy Johnson, and today I will be talking about the ethical issue of doctors withholding a diagnosis from a patient. So, withholding a negative diagnosis is very self explanatory, and it is basically just withholding a diagnosis occurs when a physician intentionally does not inform a patient of a terminal or pre-terminal illness, and there's several main reasons a physician might withhold a diagnosis. One of those being the concern of a patient's mental health status and their ability to cope with a negative diagnosis, which has a lot to do with the concept of beneficence, which we're going to talk about here shortly. Another common reason physicians withhold negative diagnosis is a family member has approached the physician and asked to withhold diagnosis from a patient. Something else that a physician must consider when talking about negative diagnosis is religious beliefs or cultural backgrounds that could make full disclosure inappropriate. So one example of this was found by Creasy and colleagues, and they found that there are certain Navajo beliefs that say that whenever you hear about a potential risk, you actually invite them to occur um, in an individual's life. And so it is tough for physicians to navigate that, and so they really do have to be culturally aware, and sometimes they might discern that just withholding a diagnosis is more appropriate. And then another major reason listed by physicians is just a lack of time to have full and involved conversations about a diagnosis, um, which isn't necessarily acting in beneficence. It's just a physician not having time nor the capacity to connect and have these hard emotional conversations and really empathizing well with patients. So some of the ethical concerns raised here are just that a terminal diagnosis with a negative prognosis could cause more harm than good to a patient. And then, will the knowledge learned in a medical diagnosis increase a patient's chance of survival or quality of life, or will it distress a patient and decrease their remaining quality of life? Something else to consider is that by not fully explaining a diagnosis, physicians do lie to their patients, and so that the ethical concern raised there is if a physician has to be fully honest with the patient, does not telling the whole truth count as lying, or uh, is that still acting in honesty whenever we only give partial disclosure? Something else is that if the family of a patient asks a physician to withhold a diagnosis to a patient, is the physician bound to total honesty with the patient despite the family's request? So who is the physician supposed to be, loyal to in this situation? Also, the another huge ethical concern raised in this situation is that whenever a patient is not given full disclosure about their diagnosis or about their medical state, they are being denied their autonomy and their ability to be involved in shared decision making regarding their treatment and just the next steps for them. So, something to consider here is that in 1847, the American Medical Act stated that physicians' sacred duty is to avoid all things which have a tendency to discourage the patient and depress his spirits. So this was in 1847, and so at that time there were a lot of physicians not explaining diagnosis and fully telling patients about a diagnosis because it was a death sentence, and they saw that there's no point in ruining the remaining quality of life for this patient. And so that was acting at that time in beneficence, which is considering the welfare of the subject first and foremost. But I mean, this is slightly barbaric. This is the 1800s, 1847, and medical technology and treatments have just come so far in this time. And so there's actually now legal obligations for patients or for physicians to fully inform a patient of a diagnosis. There's no excuse or reason that legally there's no reason or excuse that a physician should not tell a patient everything going on in their body. This is a really big problem for physicians, and it's actually reported as one of the most common ethical dilemmas for healthcare providers. But whenever patients were asked if they would want to know if they had a terminal diagnosis, 90% of them did say that yes, they want to be informed of a terminal diagnosis and negative prognosis. So some ethical tension does come here. Medscape did a study and asked physicians, would you ever hide information from a patient about a terminal or pre-terminal diagnosis in an effort to bolster their spirit or attitude, which is kind of going along with the concept of beneficence, of bolstering their spirits or attitudes. And physicians really were not consistent in their responses, and a lot of them didn't know where they stood. So 60%, more than half, did agree that full disclosure is mandatory and of the utmost importance. But 15% did say that they would soften a diagnosis, which involves not totally telling everything going on. So once again, we have to ask, is telling a partial truth the same as telling a blatant lie? 2% of physicians did say that if a person is not going to die immediately, they're not going to tell a patient how bad the diagnosis is. And then almost a quarter of physicians said it depends, case by case. They have to decide every time. It's not set in their mind that they're always going to give full disclosure. So looking at Nash's 3 moral languages that he talks about and how to apply them to this case, the first being background beliefs. In our textbook, Real World Ethics, Robert Nash describes background beliefs as the most fundamental assumptions that guide our perceptions about the nature of reality and what we experience as good or bad, right or wrong, important or unimportant. These assumptions are the ultimate basis by which we make our ethical decisions. So some background beliefs to consider in the issue of full or withholding diagnosis are stated here. And so one physician, when prompted, responded that the truth delivered with compassion is a gift. So he believes that the truth, whenever as he says, the delivered with compassion is a gift. Another background belief that physicians might hold is that sharing this negative diagnosis is actually a Hippocratic oath violation because they are called to do no harm. And so some believe that by giving a negative diagnosis to a patient, they are actually doing harm, and this is a violation of their Hippocratic oath. Another background belief to consider is that just the patient-physician relationship is almost sacred and that it should always be defined by trust. And so withholding a diagnosis could really jeopardize the trust between the patient and physician in medical community. So the next thing to consider is moral character. In 2007, in a revised essay, Robert Nash writes, "It is a psychological and sociological language. It is a language of personal narrative. It's a language of everyday morality, full of parables, down-home maxims, proverbs, and memorable moral bromides. It is not afraid to speak of feelings, intuitions, personal and communal stories, concrete community, and desirable virtues." So one physician, when prompted, says that it's not about hiding information. It's learning how to talk to patients and giving bad news in the best way possible. All the information should be given, but any positive that exists should be talked about also. And so then we can ask, if a physician perceives honesty, no matter the cost, to be a defining part of his or her character, they will be much less likely to withhold information because being fully honest at all times is acting in character for that situation. But then we can look and say, if a physician sees empathy to be a defining part of his or her character, he or she may, under some circumstances, feel that withholding a negative diagnosis or prognosis will be acting most in character because they really empathize with this patient and understand that it could do a lot of harm. And so acting in character is acting in a way that's not going to emotionally disturb the patient. The last moral language that Nash is going to talk about is moral principle, and he says here that it's like a prince. It functions as a kind of general lawgiver, a guide to action, a sovereign authority, and ethical decision making. So once again, another physician says regarding moral principle when prompted about withholding a diagnosis, most of the time I tell them exactly as it is. They need to know the truth, and who am I to judge what they should or shouldn't know? However, if the patient is frail emotionally and physically and has a very supportive family, I may not. So we can also say, does the physician's moral principle suggest that he or she must always uphold legal obligations, regardless of how it could affect the patient? Or does a physician's principles force them to spare the heartbreak of a negative prognosis when there is nothing a patient can do about it, regardless of the legal repercussions? Thankfully, though, this is a tricky thing to navigate, and the Health Educator Code of Ethics is pretty clear about how we as health educators should act. The Code of Ethics really focuses a lot about people are entitled to informed decision making regarding their health, and that people need to be actively involved. So the main areas in the Code of Ethics are going to be Articles 1 and 4 when talking about withholding information or just full consent. So, Article 1, Section 1 states that health educators support the right of individuals to make informed decisions regarding their health, as long as such decisions pose no threat to the health of others. So, the key here when dealing with withholding information is informed decisions regarding their health. Obviously, um, you can't make an informed decision regarding your health if you don't know what's going on in your life, if you don't know what the diagnosis is, which also goes back to what I mentioned earlier about whenever people are not given their full diagnosis, they are being denied their autonomy and the ability to make informed, shared decisions regarding treatment and just where to go on from here. So Article 1, Section 4 is going to state that health educators accept the responsibility to act on issues that can adversely affect the health of individuals, families, and communities. And we should be acting on the issues of partial and full disclosure because a person's diagnosis dramatically affects their health and what's going on in their families and the people that are close to them. Article 1, Section 7 says health educators actively involve individuals, groups, and communities in the entire educational process so that all aspects of the process are clearly understood by those who may be affected. Once again, this is really advocating that people know what's going on in their bodies and are able to make decisions because it's been clearly explained to them and they know fully what's going on. Article 4, Section 4 states that health educators empower individuals to adopt healthy lifestyles through informed choice rather than coercion or intimidation. The key here being informed choice and adopting a healthy lifestyle through that. There's certain, if someone is diagnosed, has a terminal diagnosis, there are options to improve quality of life through adopting different healthy lifestyles, and people need to know about what's going on so they can make those choices. Article 4, Section 5 says that health educators communicate the potential outcomes of proposed services, strategies, and pending decisions to all individuals who will be affected. So, once again, this is really just a cry for people to know, be able to make decisions and know what's going on in their bodies so they can act in a way that promotes their health and the health of those around them. So, where do I stand on this? Looking at my background beliefs, moral character, and moral principle. Fundamentally, I do believe, just have the background belief that people are entitled to know what's going on in their bodies. And I also believe that there's really no circumstance where lying is appropriate. I also believe that withholding or not giving a full truth is a lie. And also something I really value is the trust between a physician and patient. I think that everyone is entitled to leave a physician's appointment or leave a doctor just feeling like there's been total transparency and that they can either make informed decisions or be at ease. So I do think that trust there is very, very important. But then my moral character kind of puts me in a little bit of conflict with giving a patient a negative diagnosis when I know it could really, really do some damage to them, is because I really value relationships and empathizing with people and discerning different situations differently. Every person is different, and so it's hard imagining me having to tell an elderly woman with no family, that she has a really terminal disease, because she's elderly, has no family. That could really, really hurt her, and the remaining quality of life that she has could totally be destroyed by that. And also, I do just desire to do the minimal amount of harm to people. I'm the people pleaser, but also I hate the idea of possibly telling someone something that could really harm them. But then whenever I look at moral principle, I do stress that I'm only as good as my word. And so dishonesty does compromise a key principle that I try to base my life on. And also, I think that laws within reason are good and should be followed. So I must act in accordance with a code of ethics or professional standards. And so that does lead me to believe that providing full disclosure to a patient is of the utmost importance. Patients deserve to know what's going on in their bodies regardless of the outcome so that they can make proper decisions and arrangements for whatever may come. Physicians can have hard conversations in a respectful and kind manner by getting to know their patients' customs, values, and beliefs, and consulting with patient educators or advocate. So this is kind of just the overview of what I believe. I believe that there really isn't. It's not appropriate to withhold information, and that there's positive ways to do that. So, anyways, thank you so much for your time and listening. Here's my references, and I hope you have a great day.